Thank you to everyone who is joining. We know that for some of you, it's your mornings, others it's afternoon, and for some of you, it's very late in the evening. So we really appreciate you joining us today. My name is Manju Chatani Gada. I'm the Director of Partnerships and Capacity Strengthening at AVAC, and I'm we're delighted to come together as APA, the African Women's Prevention Community Accountability Board, the Children's Investment Fund, CIF, the Global Fund, and the Population Council to launch this exciting new initiative. This initiative, funding initiative announced by CIF in partnership with the Global Fund at AIDS 2024 earlier this year. It's an early market access vehicle to purchase up to 150,000 Depivirine vaginal rings in countries implementing Global Fund HIV grants. During this webinar, you will hear from advocates about the importance of choice in HIV prevention, a bit of background about the ring, future vaginal ring products, as well as an overview of this new funding initiative, how to benefit from it, and resources to support countries in developing their requests for the introduction of the ring. We have a fantastic lineup of speakers today. First, Yvette Raphael from APA will be talking to advocates to talk about the importance of having this opportunity at all. She'll be speaking to Sine Intlantla Gogela, who is an APA champion working with the APA Prevention Ground Forces, with Seema Syed from Asta Parivar in Mumbai, working with sex workers, their children and adolescent girls and young women at risk for HIV in India. Next, we're going to have a brief overview of the ring information from Heather Ingold. She's a program manager for the Global HIV, Hepatitis, and STIs program at the WHO. Bridge Devlin, who is Chief Scientific Officer at Population Council, responsible for drug development projects, will be talking to us about the product pipeline for the Depivirine ring. The next, Amina Jafar, who's a specialist health product introduction at the Global Fund, will give us an overview of this early market access vehicle. Next, Chris Obermeyer, who's technical HIV lead for HIV prevention at the Global Fund, will walk through the request form, make it easier to understand and complete. And then Philip Emohi, a regional technical advisor for FHI 360, will talk to us about the available resources and technical support available to countries who are looking at applying for this. And finally, we have a good amount of time for your questions for all the speakers that Chris will be leading us through. Next slide. And here it is. And just the next slide, Amina. So just want to remind everyone that this call is recorded. So you will get a copy of it after the fact if you fall off or aren't able to stay. To ask questions, please ask them via the Q&A button at the bottom of the screen. Or please raise your hand and when prompted, and we'd be happy to open the line, time given, to hear from all of you. There's a lot of people who are going to present. It's a really exciting launch of this initiative. So we'll do the best we can to stay to agenda. And thank you for understanding if we have to rush up some of those sections. So we have about 400 people registered for the call today. So there's a lot of excitement. So let us get started. And first, I would like to welcome Yvette Raphael, my comrade, to get us started. Welcome, Yvette.
Thank you so much, Manju. Good afternoon and welcome to this launch webinar, a great partnership to ensure that women do get access to HIV prevention methods that they choose. What amazing time that we are in, where we have an advocate from South Africa and an advocate from India speaking about the need, just what is basically needed to make sure that young people have access, women have access to HIV prevention methods. As you can hear, my voice sounds like it's gone. It's not out of because maybe I was dancing somewhere. We just concluded a 2-day HIV prevention boot camp with young women, young leaders in South Africa. And we were talking about the importance of choice. Why is it important that all of these methods that are made available are accessible, but most importantly, young people take it up? We do have the ring currently. We have all of the prevention baskets, some not ready and available yet, some still in studies. But importantly is that currently the ring is one of the prevention methods that are available, long acting, which is 1 month, and also very, available and discreet, all of the things that we know about the ring. But Manju, most importantly, and my comrades, today we had this session, but we got very emotional. Where do we come from? We come from a space where the only HIV prevention method was a condom. We are in a different era. We are in a different space. We are in a prevention revolution, and we only have this time to make sure we change the world for women, young people, but most importantly for everyone, so that we know HIV prevention is not it's not a favor, but it becomes a human right. So I'm excited that today we have Sima and Sinentlantla on the line to talk about why is this ring important? Why is it so important for us to take this time where we are in to ensure that ring becomes available? And how can we ensure that young women take this up? So without further ado, I would like to start with, with Sima to talk to us about why is India's advocates excited about the ring and why are we here? Thank you. Over to you, Sima.
Thank you, Yvette, and thank you, everyone, for this opportunity. I'm glad to share my views concerning HIV prevention, particularly among women and young girls who engage in risk behaviors. Uh, we all know that post-COVID scenario is really challenging, and we've seen in the communities that we work. I work with Astha Parivar, which is a community-led organization working with high-risk population, and now with young women and adolescents as well. And we've come across individuals encountering a partner with an unknown HIV status, which poses significant threats. So I think there is a pressing need for additional prevention methods that empower women and girls to take charge of their health. This becomes even more critical for unmarried girls who may find it challenging to access preventive medications from hospitals or through NGOs due to a lot of societal barriers and stigma. One major concern also remains is the cost of medication, which can limit options for many. It is essential to advocate for discrete options that women and girls can control independently, promoting sustainability and enhancing access for those who need it most. The prevention of new HIV infections, we've all seen among adolescent girls and young women, is a pressing issue that requires our attention. And when something like a vaginal rings can be a game changer in this context, because they represent an innovative approach to HIV prevention that can help empower women and girls to protect their health independently. I also, because the current HIV prevention methods, Yvette, often fall short because, as many women face difficulties in negotiating condom use. Furthermore, the adherence to existing products has been a substantial challenge. Given the high burden of HIV among women, I think it is crucial to develop effective and acceptable interventions tailored to their needs. And I'm reiterating tailored to their needs is also because a lot of the HIV prevention methods that we have right now, they're also looking at multi-purpose prevention products, which can safeguard against multiple outcomes. It could be STIs, HIV, unintended pregnancies, and using a single approach could transform the landscape of women's health. I think we all working and advocating for HIV prevention should be working towards identifying and promoting the options that best serve their needs. So I think, yeah, again, I'm saying something like a vaginal ring can be an option for these women who are really looking at HIV prevention and protecting their health independently. The choice should be in their hands is what I feel. They should be given a choice. And most of the times we've seen they're always dependent on their male partners or the clients or their boyfriends or intimate partner, whatever. I think if given a choice and if they can protect, I think they take their decisions independently. Yeah, so that's it that I feel is.
Thank you so much, Seema, for those insights and reminding us some of the challenges that women face when trying to access HIV prevention methods that is important for them. But I think most importantly that I got out of your talk is that we are at an important time. If HIV prevention methods are not taken up now, what about the future methods that are in research right now? So we are at a very, very important space when it comes to HIV prevention. Will women take them up, and how are we going to support them to take it up? Without further ado, because of time, it's my pleasure to bring Sinenhlanhla Gogela, a young person from South Africa who's been part of the ring advocacy for many years. As a young person, today, Sinenhlanhla is a young woman, and this product is effective, it's available, and she is one of the leaders in South Africa as a ground force alumni, as a champion, but most importantly, as a young person who is ready to take up HIV prevention methods. Sinenhlanhla, what do you think should be done, and how should we navigate getting young women to access this HIV prevention? Young women in their diversity, I must add. Over to you, Sinenhlanhla.
Okay, thank you so much for having me. Today, in many parts of the world, right, young women are still disproportionately with. And in the sub-Saharan Africa, for instance, adolescent girls and young women make over up to 60% of new HIV infections among young people. This isn't just like a statistic. It's a reflection of the challenges that we as young women are facing on a daily basis, right? And the Depiferine vaginal ring is a powerful tool that offers all solutions. It's more than just a new tool, but it's a tool for empowerment, right? With the ring, young women can take charge of their own health in their own terms because it's discreet, it's safe, and it provides a month-long prevention without requiring daily pills or partner negotiation. And that is convenience, because if we take a look at the countries that we are living in Africa, patriarchy exists, and we also need to look at like gender dynamics and power dynamics in relationships. Young women cannot initiate because of other things. In countries where gender-based violence is prevalent, poverty is also. So when a young woman has to the Depiferine ring, all of those things cease to exist because she is empowered, right? And for many of us young women, it means we can safeguard our health with our aspirations. And some of the ways that we can promote the ring is actually through online social media platforms, because young people are there. And I think most importantly, we need also the support of everyone. For an example, we need to make HIV prevention fashionable. We need to make it not something that is a prescription, something that is hard, something that we need to go through. It's a part of our daily lives. It's the same as having to eat. It's the same as having to eat water. It's part of who you are. It's your sexual health. It's taking up, it's you being empowered. So that is why it's important we need access to this core prevention, which is the DEPIVA ring, because it's not just a ring. It empowers young women all over the world. So it is truly much important. It's a game changer. And as APA is in a whole new dimension of #Prevolution, it means that we need all the choices that we need to have, and we need to have access to. You know, we need, I mean, I don't know how to put it, but we need choices, we need options, and the DEPIVA ring needs to be one of those options or choices that young women are able to access. And honestly, the DEPIVA ring is feminist because it is for women, by women, and therefore that is why it is important that we access it and we have it in our hands. And when we go to our clinics, we are given the ring and we are able to have access to it. So it is a game changer. It is Prevolution. #give us the ring now. #access. #we want the ring now in our vaginas. Thank you.
Thank you so much, Sinenhlanhla. I think we feel the fire, we feel the passion, and just how important this is for us and for women at this stage. So I'm going to give over to the next speaker. Manju, over to you. But we've heard from the advocates, we want the ring now, and we want to make sure that young women and girls are able to prevent HIV the way they want to, with the choices that they choose. And the ring is one such option. Thank you.
Thank you so much to Yvette and Sine and Seema for getting us started. You really framed how important this discussion is, and you brought the focus in here that this is in numbers. This is people, and these are especially young women making choices. So thank you so much. So I saw that there was one question. I'm going to ask for your patience to hold your questions for us to get through a few of the presentations, and we have left enough time at the end, we hope. And keep your questions coming through the Q&A, and Caleb, my colleague, has given us instructions how. So next, I'd like to invite Breach Devlin from, I'm so sorry. Next, I'm going to invite Heather Ingold from the WHO to give us a brief overview of the ring. Heather?
Thank you, Manju. It's a little difficult going after Yvette and Sina's great enthusiasm, but I will do my best. Thank you to Global Fund and SIF and to the other organizers for having WHO here today. My name is Heather Ingold. I am at the headquarters in Geneva, and I will be presenting briefly on the Depiverin vaginal ring for HIV prevention. Next slide, please. And I don't know why, but my slides look like they have flowers or something on them. I'm not sure what happened to that, but in 2021, WHO recommended the Depiverin vaginal ring to be offered as an additional prevention choice for women at substantial risk of HIV infection as part of combination prevention approaches. This was a conditional recommendation with moderate certainty of evidence. I'd also like to point out, as did our advocates, that the ring should be offered together with other PrEP products to enable women to make a choice for the product that suits their needs. Next slide, please. With regards to efficacy of the ring, a systematic review commissioned for the WHO recommendation found that the ring is effective in reducing the risk of acquiring HIV infection. In the intention to treat analysis for the 2 reported RCTs, it was approximately 30% effective in reducing HIV infection. Following the RCTs and the open label extensions found increased efficacy, increased adherence, and increased retention relative to the randomized controlled trials. Equally, if not more important, a secondary analysis of the randomized trial was done and found greater adherence exceeding 50% and possibly as high as 75%. So the ring works. We know you want it. We just need to get it out there. So hopefully we'll make that happen together with Global Fund and CIF. Next slide, please. With regards to safety during pregnancy and breastfeeding, studies during pregnancy have shown a favorable safety profile among pregnant women and their infants, and there's no evidence of negative impact on pregnancy or infant outcomes. With regards to during preconception and early pregnancy, the ASPIRE trial did not enroll pregnant individuals. However, they did have almost 90 incident pregnancies occurring among participants using the dapivirine ring, which offered insights on preconception and early pregnancy exposure safety data. Among these participants, there was no impact on fertility rates and no association with preterm birth, pregnancy loss, congenital anomalies, or poor infant growth. During pregnancy, DELIVER was the first major study among pregnant individuals in 3 gestational age cohorts. Participants were randomized to use the ring or oral PrEP through delivery. And data showed that the ring had no association with preterm birth or stillbirth or maternal or infant SAEs. There were also no seroconversions, and pregnancy complications were uncommon, similar to the background rates observed in study communities. Similarly, during breastfeeding, Be Protected enrolled approximately 200 exclusive breastfeeding mother-infant pairs. Participants were randomized to use the ring or oral PrEP with product used for 12 weeks. Key findings showed a good safety profile in both mothers and infants, no SAEs related to the ring in either group, and very little dapivirine present in milk, and even less passed to the infants. Next slide, please. I think this is my last. Implementation considerations and research gaps. As mentioned, we recommend that the dapivirine ring be offered as part of a comprehensive HIV and sexual reproductive health package of services, ensuring that women are offered full information in order to make an informed choice about the benefits and potential risks when considering to use the ring, together with all other available PrEP products. We recently recommended that self-testing, HIV self-testing, can be used to initiate and reinitiate the ring, as well as for monitoring during continuous use. We noted in our recommendations that adolescent girls and young women may need some support during initiation and for continuation. Like anything that's new, once you learn how to use it, though, as we've heard from Sine, it's super easy and something that we hope in the future can be available over the counter for self-insertion. Training and support for providers is needed to understand and be able to offer this new product together with the other PrEP products available. And we do have some outstanding research gaps on cost effectiveness, but I want to note that's not just for the ring, it's also for all new PrEP products, including cabotegravir. I think this is my last slide. Next, please. Yes. So thank you all for your time. At WHO, we're very excited about this initiative and are happy to support countries as they scale up the ring. Thank you so much, Manju. Back to you.
Thanks so much, Heather. And I think it's appropriate that your slides were festive with the confetti in launching this new initiative, which, as you said, is very exciting.
I have no idea how that happened. That was on accident. But...
It worked perfectly. Well, with that, now I'm going to introduce Bridge Devlin from the Population Council to talk to us about the product pipeline for the ring and what's next.
Thank you, Manju, and thank you, Heather, and thank you very much for the energy already for this presentation. So next slide, please. So although Population Council has a robust sexual reproductive health pipeline, today I'm just going to present the dapivirine programs. I'm going to mention a little bit about the monthly dapivirine ring, where we are there, and that is a marketed product, as we all know. But there's some new developments that we'll touch on. I'll also discuss our next line, which is the extended use, the 3-month DVR, which is being prepared for regulatory line extension approval. And lastly, the contraceptive dapivirine ring. So next slide, please. So actually, Heather, you've gone through all of this already, but these are the three main label expansion studies that we've been conducting on the monthly ring. The REACH study for adolescent girls and young women. That data are submitted already to EMA for label expansion to include this population. The pregnant women, the DELIVER study, we're waiting on one cohort to complete, and that data are planned for submission to the EMA next year. And the breastfeeding women be protected that you've also presented, Heather, but that already has received approval from EMA, so we can expand the label. So importantly for the monthly ring, these are populations that have very limited access to HIV prevention, and this is a really important aspect of the monthly ring that needs to be emphasized. This is available for all these women coming up, and we're really excited about that expansion. And it flows nicely into our line extension, which is the 3-month ring, which I'll talk about now. Next slide, please. And you can go one more slide. So this product we've been working on for a number of years. It's an extended release formula of the monthly ring. So it's 4 rings required per year instead of 12. It reduces cost significantly by about 60%. It also reduces waste, and it's an increased convenience for users and also potential for increased adherence. Next slide, please. So this product is, it's the same manufacturing process, the same components as the monthly ring. It just has more dapivirine in it. Prior to the study that we just completed, we did a phase 1 trial looking at what was the right loading dose, what was the right dapivirine to put in for a 3-month product. With MTN, we conducted a phase 1 trial looking at 100 milligrams and 200 milligrams dapivirine, comparing it to the 25 milligram dapivirine ring for 13 continuous weeks. There were no safety concerns, and we showed that the difference between the 100 and 200 was very minimal, and therefore we advanced the 100 milligram for further clinical development. We've also completed our validation, our manufacturing studies at the clinical scale, and now we're validating at the commercial scale, so it'll be available once it's approved. We also completed a pivotal bioavailability trial. We had started this in 2022 and completed it in this year. Next slide, please. Now, pictures say 1,000 words, so I did want to just show you this slide. Jeremy Nuttall presented this in great detail at the HIV-R4B conference a couple of weeks ago in Lima, Peru. But this is really the significant slide that shows the superiority of the 3-month ring over the 1-month ring. On the left-hand side, it's the plasma data. The red line above is the 3-month ring continuously over 90 days. And the blue kind of hills are the 1-month product used consecutively. So you can see that the 3-month ring is a superior product. And on the right-hand side, it's the vaginal fluid levels showing that it's similar or a little bit higher in the release of the dapivirine in the vaginal fluid. And we had no safety concerns during this trial at all. Next slide, please. We also had an opportunity, and I don't know, at least on my screen, it looks like there's black dots on the rings. There are no black dots on the rings. So please disregard that if you see that. But we also had an opportunity because this in this trial, it was a crossover trial, and the women in the trial were able to use the 3-month ring and also the 1-month ring. So they have a unique opportunity to assess the acceptability of both rings. Barbara Freeland also presented a poster at HIV-R4P with much more detail on this study. But in summary, the majority of the participants interviewed preferred the 3-month ring. and it was driven by the greater convenience of having that product. Most of the participants would consider using the vaginal ring in the future, and if we discontinue the 1 month ring, they would use the 3 month ring if it's available. So that was a very significant. Yes, thank you, Martha. It does make programmatic sense. I'm just looking at the chats as they're popping up. Next slide, please. So the next steps for this particular product is we have completed the study, as I said, and we are writing the study reports right now. We've also engaged Kiara Health in South Africa for a memorandum of understanding. We hope to transfer the technology there to manufacture there in the future. Right now, we are still manufacturing in Sweden, and we are compiling our regulatory dossiers for submission to EMA early next year for an initial market entry in 2026 for the 3 month ring. And most importantly for everybody on this call, we are doing our community engagement and market access activities. So we need you, and we really appreciate your engagement here. Next slide. I want to touch on the longer, farther out product or contraceptive Depivirine ring. Next slide, please. So why are we making a contraceptive ring? We know that women face the dual risk of HIV, high rates of HIV acquisition, but also the great unmet need for modern contraception. We've seen for many studies that there's an interest in multi-purpose prevention, and there's a lack of access to contraception, and this is obviously a major contributor to maternal and newborn health, newborn deaths in LMICs. So integrating the HIV prevention and contraception would hopefully result in fewer clinical visits and greater efficiency by addressing multiple needs together, and also potentially reducing stigma associated with women that would be seeking HIV care. Next slide. So we originally had made a silicone version of this product. It was a softer silicone, and it was shown to be unacceptable for women. So we have redesigned it into a 2-layer ring. It's a sleeker design. The interior contains levonorgestrel for contraception, and the exterior layer contains Depivirine for HIV prevention. And we are currently completing a phase 1b trial that we initiated in 2022, and we'll have the data very shortly to share with you. Next slide. So moving forward and looking forward, we expect to consult with regulatory agencies to come up with a strategy for where we will file this product for approval, and also to design our phase 3 trial. And we are working with our manufacturer right now to optimize the manufacturing for this particular product. And again, and community engagement is very important in access planning to determine how and where we will make this product available. Next slide is my last slide. And we can't do this at all without the amazing funders that we've had to date, and all of you here, the stakeholders, the champions, and of course the women who have given their time to help us design these products effectively. Thank you so much. Back to you, Manju.
Thanks so much, Bridge. And I think now we are well prepared with the background and what's next to actually hear about this new market access vehicle. And I am handing over to Amina Jafar from the Global Fund to walk us through it. Amina.
Thank you, Manju. Hi, everybody. So I think we've really set the stage to try and explain to you why this is an important product. You've heard from advocates, you've heard from WHO, you've also heard from the developers of the ring. And so we would like to set the stage of why we've decided to do this and why it's important for you to access these rings. So as I'm sure a lot of you are aware, there is a very huge HIV prevention toolkit with many different options that can be chosen from. The PrEP ring is just one additional option to this toolkit and is a very essential addition, as you may have heard from loads of people today, that brings the power and allows women to have control over their choices. And so for us, what's very important is increasing the access to a variety of different options. We are also looking at how we need to think about the considerations of people needing HIV prevention for a lot of the different options that we have, from condoms all the way to Cabernet. There are perceived benefits and there are perceived limitations. And the truth is, no one PrEP prevention option is right for everybody. And so for each person, there will be pros and cons, and we really want to add the deprivation ring to this pool of PrEP options to allow people to have the choice to pick the option that works best for them. The choice manifesto was, it came out in September of 2023, and it was a call to action by women and girls in Africa. And you'll see the different logos of the different organizations that were behind this manifesto. And it was really a call to action, a call for us to ensure that we have a variety of different choices and options for HIV prevention available to women and girls. It was really making sure that we're able to scale up and increase the access of what is already existing, such as the PrEP ring, and really ensuring that women have the control over their own health and their bodies. As the Global Fund, we definitely felt that this was a key area for us to respond, and that the PrEP ring gave us an opportunity to give women those options and those choices so that they have the power to choose what it is that they would want to use as their PrEP prevention method. PrEP currently, the PrEP ring has been approved in 11 African countries with planned implementation, and some submitted approvals across additional countries. We're showing this because we want you to have an idea, as you know, if there are country representatives on the call, what countries already have the PrEP ring approved. But this is not a limitation to being able to benefit from this support, because Population Council is willing to consider additional regulatory submissions and support import waivers for countries who would also like to request for the rings. There are some countries that have already received they've already placed some orders through Global Fund or plan to, but again, this is not a limitation to wanting to expand the number of rings that you have in country through this early market access vehicle support. So one of the key things that we found while we've been having our various discussions with partners, with countries, is that cost is definitely one of the key barriers to expanding the access of the PrEP ring. Currently, the 1 month ring costs around $12.78 per month, and as Bridge mentioned, manufactured in Sweden. We are looking forward to the introduction of the 3 month ring, which also, as Bridge mentioned, would potentially take this down by 60% to about $5.33. And this we're looking at happening within roughly a year and a half. And then even further, a price reduction that we're not sure what would be, but to within 2 to 3 years have an even more affordable version of the 3 month ring that is African manufactured. So as Global Fund, what we're attempting to do is to support the expansion and the scale up of this ring product until we're able to get to a price point where more countries are willing to procure. And bridging the gap between now the 1 month ring and the 3 month ring that we envision will be available within a year and a half. So what is the early market access vehicle? What we're really trying to do is to expand ring access to women and girls, really looking at how we're able to directly address the choice manifesto with the PrEP products, but with the PrEP ring, also taking into consideration that other products such as CAB have limited quantities in the coming future. And so we really need to ensure that what we do have would be easily available. The current price barriers, like I've also mentioned, has really hindered wide-scale uptake. And so looking at how we're able to provide a bridge from now to that 3-month ring that would be easily more affordable to countries. So as the largest funder for PrEP, the Global Fund, in collaboration with the Children's Investment Fund Foundation, are planning to implement this early market access vehicle. This vehicle will basically ensure that countries are able to access up to 150,000 PrEP rings through a request-based system. And Chris will speak to you a little bit more about the requests soon. This was announced in, the EMAV was announced in Munich earlier this year at AIDS 24, and you can see Zine there. She gave such a wonderful and emotive speech as to why this is important, similar to what you heard from her today. And I think that this was really a call to action that we felt that really needed to be addressed. And I think we're doing our best to do so. There is a recording actually of this introduction, and I will see if Chris is able to share with us all so you can all hear, because honestly, it was a very emotional moment. And for me, really highlighted why choice is important and why we need to make sure that everybody has access to what works specifically for them. So in terms of the EMAV, in a high-level summary, what it is we're basically facilitating immediate access to the 1-month ring. This is going to be done by giving countries the ability to request some of the PrEP rings, and then this would basically bridge the gap between this 1-month ring now to the 3-month ring, where we expect there would be a cheaper alternative. The mechanism of this is request forms, which are currently published and available on the PrEP-Watch websites. Countries can go to those, to the websites, access the forms. We have it available in a variety of different languages. I believe currently it's available in English, Spanish, French, and Portuguese. And if any country requires a different language of the form, you can send an email to emav@cif.org, and we will provide it for you in the appropriate language. So what we expect is that countries would get the form from the PrEP-Watch website, then discuss internally with the advocates, the governments, and the partners to align on the request of how many rings a country would want to request for. They would complete the form and then submit that form to CIF via the emav@cif.org email address. CIF would then convene a committee who would review and approve on a rolling basis. It's important to mention that it is on a first-come, first-served basis. And then the applicants will be notified of their approval, or if there are any changes that need to be made. And then the applicants and Global Fund will work together to process the order through wambu.org. And that would eventually lead to the orders then being delivered and distributed according to the plan outlined in the request. Who is eligible for this initiative? It is any country entities with HIV product procurement and supply chain responsibilities are allowed to apply. They must be from countries that received an HIV allocation for grant cycle 7 from the Global Fund. We would require that your application be endorsed by the National Ministry of Health or whatever government agency is responsible for the HIV response within that country needs to endorse the request. Like I mentioned previously, project registration is not required as long as an import waiver can be obtained for these requests. The available volumes, we have a minimum and maximum volume that we are allowing in each application. So each country can apply for a minimum of 2,400 rings and a maximum of 24,000 rings. This is per country and will be utilized across 2025 and 2026. Like I mentioned previously, it is on a rolling basis that approvals will be given, and it will be on a first come, first served basis. As long as the countries meet the request criteria, which Chris will speak to, then approvals will be provided. There would be on the PrEP Watch and the AVAC website updates on volumes and allocations, so countries can see when as the rings are depleting from the EMAV. There would also be a request from countries to submit quarterly reports to CIF, leveraging on reporting of Global Fund and PEPFAR, as well as a CIF specified request in terms of M&E. I think at this point, I will hand over to Chris, who will talk to you further around evaluations.
And
Yeah,
as
so
Chris is coming on, I just keep seeing questions in the in the chat. Thank you so much for having them. Please, could you put them in the Q&A so during the discussion time, Chris and others can respond to them. Thank you. Sorry, Chris, back to you.
no, you're great. Thanks so much. So in terms of the evaluation criteria, we wanted to make them quite straightforward for applicants to be able to make sure that they kind of meet the mark. And so there's 7 key criteria. First one, Amina has already mentioned, it must be endorsed by the National Ministry of Health or other government agency responsible for the HIV response. We also, excuse me, we want to make sure that the request outlines a strategy to have national guidelines and operational procedures in place. And so that needs to align with WHO. So we want to make sure that those are in place. So if a country already has guidelines, they're good to go. If they don't have guidelines, we need to understand how they're going to have those in place before rings are delivered. The last thing we want is for rings to be sitting in a warehouse while countries are going through the process to develop guidelines. And they could be national guidelines, but they could also be operational procedures, something to make sure that they're actually being provided in a safe and WHO aligned way. We also want to make sure that the outline, the request is clear about how the rings are going to be used for the highest potential impact. So we want to see which populations, which geographies, so we can understand what impact will those rings have in the populations that are going to be receiving them. We also want to make sure that the products don't get stuck due to supply chain challenges. So we want to make sure that it's clear within that request who's going to make sure the product passes through customs, its clearance, who's going to make sure that it's stored in, in a central warehouse, how's it going to get to the places that are actually going to be distributing it, what sort of provider training, demand creation, all of that. And so we want to see just general plans for those. We also want to make sure that the results are reported. If the rings all go to country and there's no reporting, it's very difficult to advocate for additional rings or to push forward for scale up or wider access. And so it's really important that it's clear how those rings are going to be kind of monitored for their use. And that might be through CIF, but it also might be, if it's delivered by a global fund or PEPFAR partner, reported through those mechanisms. And then we also, finally, we want to make sure that there's a plan for ongoing access to the ring once the EMAV has ended. And so we want to see after 2026, what is the plan for additional rings to be made available? Is there a plan perhaps for scale up after the first year? We want to see what that plan is to make sure that people who want this product and need this product continue to have access. With that, I want to spend a few moments just to walk through the form itself, because I think that will help us all get an idea for actually how simple this could be. So I'm going to be sharing the English version, but again, as Amina pointed out, it is available in Portuguese, French, and Spanish. So the first part of the request form, and again, these are already live. If a colleague at AVAC has just a second and they want to drop that link into the chat, that would be great. Otherwise, I can do it in a moment. But the first part kind of describes the early market access vehicle that Amina has gone through. I do want to note, because I think one of the questions that popped up in the Q&A that I saw is what can be done to expand the geographic reach and access to the ring. And I do want to highlight that there's no geographic limitations to who can access this ring. And so we want to make sure that people everywhere who can benefit from this product will have access to it. So it goes through that background information in the form that Amina and I have gone through. The next part is to kind of walk you through the process. The key piece being that it takes between 3 and 4 months for the product to arrive in country once the request forms are submitted and then approved. On behalf of, and CIF has committed to having a very quick turnaround as the requests are submitted, because we don't want the product to be sitting any longer. We want it to be as quickly as possible into the hands of users who can use them. We've also outlined a number of resources, and I think Philip will talk about some of this as well, a number of technical resources that are available. So from PEPFAR, from Mosaic, from WHO, from PSI and CHI, and who can access those services and who to contact in order to get support. So this could be to get support for development of the actual plan itself, which we're looking at now, but it could also be to get support for actual implementation. So all of this is kind of background, and then the actual form starts. So the first part are just who's submitting this, what's the lead organization, we need points of contact and emails, so we have any follow-up questions, all of that. We need to know that the Ministry of Health or other government agency responsible for the HIV response is supportive, and we need that documentation. And again, for each of these, you can add more rows. Here, we want to see which organizations are supportive. So having PEPFAR, USAID, US CDC, in addition to the National Ministry of Health or other bodies, is really important. Having civil society representation in organizations that are supportive of this request will just strengthen the ability and help it make it easier for those who are making the decision about supporting it, make it very clear that there's widespread support. We have a section 4, which is just asking about registration. So again, if the product is registered, it's not such a big deal, but if the product's not registered, we want to make sure that our partners are able to support the country in getting an import waiver if needed. We also want to know about the national guidelines and whether they're in place or operational procedures. And then we go into section 6, which is about how are their rings actually going to be distributed. So what either regions or districts, which populations, et cetera, and then some basic epidemiological data about those populations. And this just helps us to understand that the product is being used in a targeted way for highest impact. We also have a section for additional rationale if more information is needed. Section 8 is quite the largest piece, and that's kind of what is the strategy for different things? How are you going to engage civil society throughout the planning process? Who's going to be responsible for the M&E, the supply chain, all of those pieces? And a lot of these, which is really great, is Philip will point out many of the resources that already exist to make these pieces a bit easier for you. So if a country doesn't have a national training for the PrEP ring or the different vaginal ring, those things already exist. So Philip will highlight some really great resources that can be used to simplify responses in these areas. And then we want to know which organizations are going to be responsible or involved in providing the rings. This next section is about how will M&E be reported, which is pretty straightforward. The last piece here, section 10, is what's the plan for making sure that they're continuing to be available. And then section 11 is optional. And that's just anything else that the applicants want to tell us that may not be entirely clear in the rest of the form. Section 12, we've added that because we've had quite a few questions about what if the country wants more than 24,000, which is currently the maximum. And so here, if a country wants 100,000 or just an extra 1,000 more, they can explain, where they would deliver those. The reason of this is multiple reasons. One, if we fewer requests, we're able to support more rings to an individual country. But also, if we have a lot of requests, knowing how many rings would be desired helps largely Amina and I, and perhaps Tiff as well, to think through how can we mobilize additional resources to get those needs met. And so it's an optional section, but if there's ambition to go bigger than 24,000, I highly encourage applicants to kind of explain that out. And that's the entire request form. The rest, there's some frequently asked questions. And then here is a simple reporting template that CIF is requesting on a quarterly basis, just listing out each semester how many rings were dispensed. And so with that, I will hand it over to Manju, and then we'll come back to Q&A at the end.
Thank you, Chris and Amina. I'm already seeing lots of great questions in the Q&A. So even as we are getting ready, you may want to take a quick look at them. And now I am very happy to introduce Philip Imohi from FHI to tell us a little bit about the resources and TA available. And thank you, Philip, for keeping us on time so we have enough time for questions. Over to you, Philip.
Thank you very much, Manju, and thanks, Chris, for laying the groundwork. Yes, so my name is Philip Imohi. I'm a technical advisor with Mosaic. I'm the global team of Mosaic. I'm supporting the policy and program bit of our work, and I'm happy to be part of this Ring EMAV launch call today to just basically take us through how we as Mosaic support PrEP ring introduction. And I'll be taking us through what resources we have developed and we have available, as well as the scope of our technical assistance in this area. Next slide. Okay, just a brief overview of what the project Mosaic is about. It's a global project which is funded by PEPFAR through USAID to help individuals, especially women, prevent HIV by accelerating the introduction and scale up of new and emerging biomedical prevention products. It's a 7-year project spanning 2021 to 2028. And as part of our mandate of laying the groundwork for equitable access and scale up of PrEP products globally, we work very closely with the ministries of health in countries, missions, implementing partners, civil society groups, and other local and global stakeholders to ensure this happens while upholding our core values, which we have highlighted here. Our country coverage is also as listed here: Botswana, Eswatini, Lesotho, and others. Next slide. Yeah, again, for this section, as already mentioned, I'll be taking us through the scope of our technical assistance as Mosaic, and also share some resources we have put together that could be leveraged for PrEP ring introduction. So the scope of our TA as Mosaic is such that we work at a both site level alongside the ministries of health, implementing partners, civil society groups, just like I mentioned earlier, to strengthen the HIV prevention platforms and mechanisms within the different countries where we work, with activities ranging from, conducting analysis for PrEP target setting to incorporating WHO approved and recommended new products into national policy documents, just like Chris mentioned, guidelines, delivery platforms, M&E systems, as well as supporting the right demand generation activities and relevant trainings for new product rollout across these countries. Next slide. So this is a snapshot of Mosaic's PrEP work layered along the product introduction pathway through technical assistance, research, and research utilization activities. We work across this framework to expedite the introduction and scale up of new and emerging PrEP products. By these, we contribute to supporting the development, review, and updates of global and country-specific policy documents, contribute to market shaping surveys, just like you can see there, implementation of research activities, as well as other cross-cutting activities like strengthening youth involvement, situation analysis, local partner capacitation, and the likes. Next. Next slide. Yeah, so speaking to our TA efforts in the area of implementation research, we do have within Mosaic Project a flagship study. I'm sure most of you may have heard about it, and that is the Catalyst study. Through this study, PrEP ring alongside other new products is introduced across 5 countries: Lesotho, South Africa, Kenya, Uganda, and Zimbabwe. And this is being done through an enhanced service delivery package that supports choice for products with regulatory approvals within countries. And these ultimately is greased and refined by QI methods that cut through individual provider, facility, and community interventions. The link to some of these implementation materials are embedded here in this slide deck. I'm sure it will be shared afterwards. And I'm sure my colleagues will also be dropping this in the chat as we move on. Next. Yes, so across 5 different domains of new product introduction pathway, just like we've already seen, and for the purpose of this event, those directly related to PrEP ring introduction is basically what we'll be looking at. Mosaic has quite a number of resources, that have been developed and deployed, most of which, if not all, you would find on PrEP Watch. While we have the links to the materials embedded in this deck, like I said, GF and EMAV, the AVAC team already has like a collage of these links, and they intend to also upload them in the EMAV page on PrEP Watch. So you'll be on the lookout for that. And so under policy and planning for PrEP ring introduction, we know that supporting countries to update their guidelines to reflect the new product is key. And so Mosaic put together these adaptable PrEP template guidelines. I think Chris also mentioned that makes the process of guideline reviews to reflect the new WHO recommendations relating to these new products hassle-free for policymakers and program staff supporting this process across different countries. How it is used, the document includes prompts for national level considerations during the guideline adaptation process, and it is available both in English as well as in French for those who will be interested. Next slide. Yes, so still under the policy and planning for PrEP ring introduction, Mosaic also has the PrEP implementation plan template that countries can adapt in outlining their approach and plans towards rolling out the product. Again, like I said, this template remains up to date with the latest WHO guidance. It is designed to be adaptable to countries' contexts, allowing for incorporation of country-specific requirements on needs basis. Next slide. Yes, so moving on now to the supply chain domain, especially as it relates to PrEP ring introduction, there is this huge, robust web-based tool called PrEP. I'm sure some of us would have already used this. It helps make the process of target setting, cost and impact estimation in relation to the target, commodity forecasting and prioritization a lot more easier and pretty straightforward process. It is done through a step-by-step guide to country-specific configurations on the platform, and it can be applied, at the national, sub-national, donor, implementer, and even site level. And it can be applied to get out relevant and required outputs for multiple PrEP products simultaneously, including for PrEP ring. Next slide. So one very important area in the preparations towards rolling out the PrEP ring product is the service delivery component. I'm sure would agree. One key question would be, who are the providers? Do they have the requisite knowledge and expertise in this area? Are there materials, job aids that could be used to train these providers? I mean, the answer is yes. Mosaic, alongside its partners, have this catalog of materials like you see here, ranging from clinical training materials to training manuals to job aids, most of which have the links embedded here, that could be leveraged and adapted as you plan to capacitate providers for PrEP ring service provision. And as part of the materials developed under the Catalyst study, you will also find fact sheets, some very interesting instructional videos on uptake and use of the PrEP ring, as well as a wide range of other very interesting materials. Next slide. Yeah, so under the uptake and effective use domain, as Mosaic, we develop user-centered demand generation strategies and packages that help support product introduction, and we provide technical assistance and the use of these end-user support tools. So what you're seeing here, the HIV Prevention Ambassador Training Package, is one of these great toolkits Mosaic has put together to support PrEP uptake and continuation through the engagement of AGYWs as prevention ambassadors. Materials that come handy here also, which I'm sure the links will be dropped in the chat, are the PrEP is Choice and the Choose Me package, which has been developed and deployed in some of our Mosaic supported countries, South Africa, Zimbabwe, supporting the young end users to have the right information about available resources and products, and then putting them first in making the right decision and the right choice for themselves. Next slide. And I think this is my last slide. In same vein, and still under uptake and effective use of the PrEP ring, as well as other methods, Mosaic also had developed the HIV prevention journey tool, like you're seeing here, which is on the one side, it supports AGYWs to explore available methods that would align with their lifestyle, their preferences and needs. And on the other side, support providers to provide informed counseling based on the client's needs. You would agree that this comes in very handy. And what you would find is that you would find it in both the paper format as well as the digital format, especially in this dispensation, where reaching out to the end users through the internet is very important. In all of this, the user is put at the heart of his or her prevention journey. And as part of our TA, Mosaic can support with the adaptation of these tools to fit country-specific needs and contexts. Next slide. Yeah, I think that's my time. So thank you very much for having me. And so on behalf of Mosaic, we're happy to be continuing this conversation as we get along. Thank you, and back to you, Andrew.
Thank you so much, Philip. Those are an incredible resource of tools, and Population Council also posted that they have several tools as well. All of these are available at prepwatch.org. So please access them, as well as copies of the EMAV in several different languages on the EMAV page on PrepWatch. Chris and Amina, we have lots of great questions that have come in. I am handing over to you to help respond to them. And please indicate if you want any of the other presenters to take on some of them.
Great, yeah, thank you so much. And then thanks for those of you who put the questions in the chat, as well as the Q&A. I'm gonna go through the Q&A ones first and answer those, and then I'll get over to the chat because they're a bit more mixed in there. So the first question from Tumi, I think we've already kind of talked about this in terms of making the ring more widely accessible to all regions. This initiative is available for all countries that receive HIV allocations from the Global Fund, which I believe includes around 103, 105 countries in all regions of the world. So very, very excited from that. I think we'll come back to the question on advocacy efforts in the US. The Global Fund is very much supported by the US, but we don't have any programming that we implement in the US. We'll come back to that maybe a bit later. To the criteria from Angelo, I think we've went through those now. So those 7 criteria, and those again are going to be in the 4 different languages we mentioned on the website in that EMAV request form. In terms of the strategy for over-the-counter purpose at the country level, for over-the-counter use, that will definitely be up to regulators in individual countries. And so that strategy would have to be developed at an individual country level in alignment with national regulators. However, that would be very separate from any sort of bioequivalency study. Sandra has asked about national regulatory approvals. So if countries already have that, that certainly can make the process easier in terms of getting product to countries. But if countries do not have national regulatory approvals, they can request a waiver from their national regulators, and then our partners are happy to support in that process. In terms of the countries having a plan to continue implementation in 2026, so the plans that countries will have to submit as part of the request will cover 2025 and 2026. So we'll need to see how those rings will be available during both of those years and how those rings will be used. And in terms of kind of use beyond 2026, the plan for making rings available needs to be there, even if it's not necessarily detailed. There needs to be an intention to continue making sure that products remain available for those who want them. Let's see. And Martha has flagged, yes, absolutely, demand creation is going to be really, really important. Some of those resources that Philip has flagged are going to be really, really important for that demand creation and building awareness among potential users. And let's see, I think that's all for the Q&A, but please do feel free to continue putting them in. I'm just going to go through quickly the chat to see what questions. First question I see, Martha, you've asked about the cost of the product that Amina mentioned. That is the cost of the product being sold. So not the cost, it's not the cost of manufacturing, it's not the cost of producing. So that is the price that is going, that the Global Fund would be paying. Let's see. I think there was also a question I saw earlier, also from Martha. Great questions from Martha. Yeah, so in this situation, CIF is going to be the buyer of the product using Global Fund's pooled procurement mechanism platform. And through this mechanism, only the procurement of the product and delivery to country is what's going to be covered. And so some of that plan that in the request form will have to describe who is going to fund the kind of other pieces. Maximina raised a great point that partners will need to consult different bodies. Again, this might be that the government is actually submitting this request, but it also might be another partner in country that can manage the supply chain aspects of it, and they get the government support to move things along. This procurement actually operates kind of completely separately from all other procurements using the Global Fund's pooled procurement mechanism. And so it will not be kind of lumped together with the procurement of any other products. Let's see. Yeah, and I see a lot of support for women and all of their diversity having access. So we're very, very happy to see actually a really great geographic spread of countries that are present here, and very, very happy about that. Yeah, I welcome any more questions in the Q&A. I'm going to go back to that in just a second.
Chris?
Yes.
Lorenzo had his hand up quite early on, and I don't know, Lorenzo, if you want to ask your question now.
Well, I actually didn't have my hand up. I hit the button by mistake. But since you asked, I do have a question. The ring, is it funded through the medicine patent pool?
No, so there's not a license with medicine patent pool for any other manufacturers of the ring. So maybe Bridge, maybe if you want to speak briefly about the MOU with Kiara Health.
Yes,
And here's the recordings.
Yeah, we've put in a memorandum of understanding with Kiara Health after a lot of engagement with several groups and looking through the field, and Kiara is interested in manufacturing for us. So that is something that we're seeking right now. And we still have our manufacturer in Sweden. And I addressed that. I can go into more detail as well, but I addressed that, and also Amina did as well. Thank you.
Great. And I see Karina, I hope Karina is still here, has asked a question. It was made a statement really about information not being available in Spanish in particular. And so, great. I see Kat has already showed the request form in Spanish, but also maybe if someone can, while I continue to do the Q&A, can also share the link to the template guidelines, which are available in Spanish now, which will give all the technical background on oral PrEP and also the ring, as well as cabotegravir. So we're trying to make sure that there's more access, particularly around languages, to different resources. So if someone can share that with Karina, that would be really, really helpful. Let's see. Oh, I do want to flag, Diantha has flagged that there are demonstration ring kits and has shared an email that you can inquire about those. So if you're curious about what that ring looks like, I actually don't have my backpack. I always have one with me in my backpack, as well as the other suite of prevention options. But yeah, please do reach out to Diantha via that email. It's a really great resource. Lots of mosaic resources. Let's see.
Chris Anandi had talked about the budget for DPV under GC7, but was not clear on the roll-up plan. So probably she could explain what kind of clarification she needed. This is Wawira. Thank you.
Yeah, I think Wawira, I think you're mentioning the colleague from Indonesia. Is that right? Who was that?
It's on the comments.
Yes. Oh, yeah. Yeah, Yvette, please.
No, thank you so much, Chris, and everyone for the great presentations and also the questions coming through. I think one of the things that I would like to reiterate from the advocacy side is that Global Fund is insisting that people have proof that they will be engaging not only with themselves as an organization, but with other partners, including USAID and PEPFAR. Importantly, show that they will be able to do demand creation and how they're going to do it and how it's going to be funded. I think one of our challenges as advocates is a lot of this goes around demand creation, is a lot of pamphlets going around. We need to see how people are going to ensure that the rings that they ask for is eventually, like Sinentlanta say, ends up in vaginas and not in desks and not in boxes and not in storerooms, but actually are taken up. And we can only do that when we work with civil society to come up with these demand creation plans in their countries, in their communities where they are. We should ensure that this is a partnership, a collaboration between policymakers, funders, those who come up with all of these IEC materials, and the communities. That is very important. Otherwise, we are going to have a problem. But I'm glad, Chris, that you mentioned they must show that they are not only working for themselves, but they are working in collaboration with every single stakeholder to ensure this becomes a reality. Thank you.
Thank you.
And I do want to recognize also, I think Angelo's comment about listing in section 3 of the request form, listing community organizations or civil society specifically. Yeah, I think that's not a challenge for us to update those forms and have that listed. So it's not a requirement that there is civil society organization support, but I think it's no problem to make it more of an opt-out. I agree with that. Yes, Manju.
Thank you. I just wanted to respond to one of the questions in the chat about any updates on ring advocacy efforts in the US, and just outline that, as many on this call will know, the Population Council removed its submission to the FDA for the ring in the US because they had an indication it would not be approved. However, there have been several US-based advocates who have been engaging on this and talking about it, including having direct conversations with Pop Council. So if there are some folks on this call who are interested in being connected to them, please write to me. I'm happy to just create that connection. But I wonder, Bridge, I'm going to put you on the spot a little bit to just comment if the 3-month ring will actually be submitted in the US, or if there's any other update you want to share on that. Thank you.
Actually, we're in discussions internally about the contraceptive ring. When that trial completes, I think that's a very good opportunity for us to have a conversation with FDA. We don't have the bioavailability study. Did not have an efficacy component to it, but we have a lot of real world evidence. So this will be a really good opportunity for us to have a conversation with FDA to talk about what would be needed for an approval within the US. So it is certainly something in the forefront of our discussions, and we absolutely, like you mentioned, anybody who is interested in identifying the populations, that we could have that further. Any information that you think would be helpful for us, we'd be happy to discuss it.
Thanks, Bridge.
Thank you.
I don't see any more questions kind of coming in either to the Q&A or to the chat. And so with that, I think I'd like to just kind of just say a few thank yous. I think this initiative and building this out started probably 10 months ago. And so, on behalf of the Global Fund, we've been very, very thankful for CIF as such a great partner in funding this. We've been really appreciative of a Population Council. We've been very appreciative of other partners of Population Council and our suppliers, and amongst them, it's been a lot of work to get this together. This is a different way of working, and we're really, really happy that we were able to work across the partnership with WHO as well as UNITAID and AVAC, who has been very generous in hosting this, to get this all together. We're thankful for the other presenters today, for colleagues from Mosaic, of course, as well as our advocates who have been able to be here and really kind of bring this home to us. And so we're very, very thankful for that, and we're really excited to be part of this. It's definitely been a labor of love And we're excited that we can, really put this together. And we're excited that, up to 150,000 people will be able to benefit from this, as well as, create that market so that people continue to have this as a prevention choice in their toolkit for the periods of their life that they need that. And so with that, I'd just like to say thank you so much. And please do reach out via email to the EMAV@SIF.org for any final questions. And if I forgot to thank you, it's my mind, not my heart. And thank you so much.
Thank you to all those who took their time out to speak today as well. Really appreciative, especially Seema and Sina, really, and Yvette, really appreciate you showing what it means for real people who actually require these products. I think it is very important for your voices to be heard. It's not just about what us as programmatic people want to do, but also what this means for real life individuals who live every day requiring these commodities that we're trying to provide. So thank you all so much for giving us your time today.
Thanks all.
Thanks, everyone. And please remember to check PrEP Watch for all the resources that we've talked about over here. Thanks again, all.
Thank you.